Zarigi. Mr. Brown, if you would join us at the podium, please, sir. Mr. Brown, President of the Firefighters, asked to address the forum. So you have 5 minutes, Mr. Brown.
Thank you very much. Thank you all for coming out tonight. What I wanted to basically do is introduce to you who we are as a fire department, what we do as a fire department, and then I will get into the history of the Plymouth firefighters with bargaining, going to the JLMC, and our current award situation. So this is who we are as a fire department, town of Plymouth. There's 117 members. Other than the city of Brockton, we are the largest and busiest fire department in Plymouth County, made up of 27 municipalities. 104 of the 117 members reside within the town of Plymouth. We live here, we work here, we raise our families here. We are invested in the community. Over the past 2 years, the Plymouth firefighters have donated over $23,000 to local and national charities, Little League teams in town, Muscular Dystrophy Association, and so forth. 75 of our current members are veterans. We have served our country. Now we proudly serve the residents of the town of Plymouth. What we do. The fire department does fire and emergency medical services. In 2013, there were 8,742 fire apparatus responses, with additional 3,127 non-life-threatening medical calls. We also do fire inspections and prevention. We're the ones who set up all the fire codes that go into this building. We do the inspections on your schools and make sure your kids are safe and in your residences. In 2013, there were a total of 5,032 total permits issued. In 2002, the minimum manning staffing level for the fire department was 29 members per shift. In 2014, the number was 21 firefighters per shift. That's equal to a minimum manning decrease of 29% in the last 12 years. Since 2002, our call volume has increased 49%. So our staffing per shift is reduced at some times to 29%, but our call volume over the last year, since 2002, has increased 49%. We're often asked to do more with less. Plymouth firefighters are always on the forefront. Nicole's Law, enacted in March 31st, 2006, after tragedy struck the Plymouth community. This law requires carbon monoxide detectors to be placed in all homes throughout Massachusetts. Countless lives have been saved since its implementation. Working with Senator Murray, the fire department helped draft a law to provide fire regulations for homeless shelters and places of worship. This groundbreaking law allowed the town's homeless population a place to seek shelter during the cold winter months. Narcan, enacted just last week, March 14, 2014, the Plymouth firefighters embraced and expedited this training to better serve our community during this drug epidemic. This was done at no cost to the town. We are proud to say that last night, less than 1 week from the implementation of its implementation, the Plymouth firefighters utilized this advanced training to save a life. Get into the previous JLMC decision. The contract period from the previous decision, which went to arbitration, was 2009 through 2012. The arbitrator that proceeded over this hearing was also the same one that proceeded over our most recent hearing. This decision came down. We were in the midst of an economic recession. It was recognized and shared by our members. Plymouth's Moody's bond rating had been downgraded. A license agreement with Entergy was in flux, and there was no pilot agreement. Residential home sales also had plummeted. We were asked to tighten our belts by the selectmen and the executive branch of the Plymouth government, and we were willing to do our part. We came out of this arbitration, we received a 2% pay raise over a 3-year period. Now that we are 5 years out, that is equal to a 0.4% pay increase annually over the last 5 years. The rate of inflation in that same period was 9%. In 2011, our health care benefits were changed by the town. Our co-pays and deductibles have since tripled, saving the town millions. Costs have risen, yet salaries have remained largely the same. Madam Facilitator, could I ask for an extension? Oh, a minute, if that.
He has 15 seconds left. All right, so show of hands.
30 seconds.
Mr. Brown, an opportunity for an additional 1 to 2 minutes.
Yeah, that'd be more than enough. Thank you. Thank you very much. The current JLMC decision, the contract period goes from 2012 to 2015. We are in the midst of an economic recovery, thankfully. The Moody's bond rating for the town of Plymouth has since been upgraded. A 20-year NRC licensing agreement with Entergy has been agreed to, and a 3-year, $29 million pilot agreement has been agreed to. There's also been a surge in new growth. Using the town's selected comparables, evidence was entered to show a 9.4% lag in total compensation from our surrounding communities. The Plymouth Fire Department is one of the lowest paid fire departments on the South Shore. The town conceded during testimony that a 15-year firefighter with a bachelor's degree earns $5,500 less annually than a comparable 15-year patrolman in Plymouth. Summary. The arbiter looks at facts and figures to come up with their decision. In 2008, the same arbitrator gave what we considered to be an unfavorable decision. It was a tougher economic time for the community, and he took that into scope, and he gave us 2% over 3 years. If Article 1 is voted down and we go back to arbitration, the numbers are not going to change. With the uptick in the economy, the numbers next time will most likely be larger. We do not want to kick the can down the road anymore. No other working group in town, union or non-union, will automatically receive increased compensation package if this passes. Parity clauses or Me Too clauses are illegal in Massachusetts. The Plymouth firefighters deserve to be compensated at a comparable rate. Plymouth firefighters are not asking to be the highest paid fire department on the South Shore. We just don't deserve to be the lowest. Thank you.
Thank you, Mr. Brown. Questions for Mr. Brown? Please join us at the microphone. Introduce yourself. Mr. Malaguti, I believe you had your hand raised. Oh. Okay.
Chris Green, Precinct 7. Could you explain the comparable of the other fire departments in the South Shore?
Sure. When we go to arbitration, especially, well, this time through arbitration, I should say, the firefighters picked what we considered to be comparables to the town of Plymouth. We picked communities like Weymouth, Waltham, communities that had roughly close to the same amount of population, the same amount of firefighters. We also picked the same amount of fire stations, the call volume. You know, it's tough to find a town that resembles Plymouth. We have, Cranberry Bogs, and we have urban areas. We have a nuclear power plant and an airport, so it's tough to get all that. But we took into certain things into consideration and came up with our comparables. The town also chose their comparables, and the town chose their comparables largely from what I could take based on geographic location. They believe that the Plymouth Fire Department should be compared to towns like Sandwich. Sandwich has, I think, 18 firefighters, and they do about 1,500 calls a year compared to us, which is 117. They also use towns like Kingston, Duxbury, and believe that they were comparable to what we do and what we face on a daily basis. What we found with our numbers when we compared ourselves to communities that we believe were similar to us was we had a 15% total compensation lag. We were behind those communities that resembled us by 15% in total compensation. The arbiter, the town, and us all argued which comparables to use. So the arbiter decided to use what the town of Plymouth put forward. When he put forward his comparables, the town argued that there was only a 3% lag. Either way, we had a lag. And it was, even the town was admitting there was a lag, and we were admitting there was a lag. The town's comparables, as noted in the award, show that a lot of the contracts they were using were old contracts. They were from 2009. They weren't up to date. They were from 2012, 2013. We found the comparables that the town selected. We looked them up, and we found that we had a 9.4% lag, even utilizing the town's comparables, which are usually more favorable to the town's arguments. Any way you look at it, we have a lag in compensation, whether it's the town's comparables or our comparables. As far as internal comparables, we're only compared to the police department in this town. excuse me, because we both work 24-hour shifts. We work every holiday. We're open and closed. We have dangerous jobs. Therefore, they always use the police department as our comparison. That's where we came up with the 15-year firefighter versus 15-year patrolman and the lag that was there.
Thank you. Question? Please join us at the microphone.
Hi, my name is Sheila Joyce. I live in Precinct 15. If I could address Mr. Brown. Putting benefits aside, vacation, pay, whatever, would I have difficulty understanding why they didn't agree to drug and alcohol testing?
Mr. Brown?
I'm glad you asked that. That's often a hot-button topic, and we see a lot of towns coming into issues with that. The truth of the matter is there already is a drug and alcohol procedure with the Plymouth Fire Department. The chief can have any member tested for drugs and alcohol if he has just cause to believe that that person may or may not be under the influence of alcohol. Random drug testing is complex, it's expensive. It wasn't stated how it was going to be covered, how random it was going to be. Was it going to be 3 members a week, 3 members a day, getting pulled out of their stations to get tested? An arbiter found that there's no reason to implement it because never in the history of the Plymouth Fire Department has any member been disciplined for being under the influence of drug or alcohol while on duty.
Any other questions for Mr. Brown? I have one. How many times has the chief requested that a firefighter have a drug test or alcohol test in the last 5 years?
I honestly would hate to answer that without the chief being here. I'm not sure if there's been many that we haven't given him reason to be honest with you. I'm not privy, and I don't want to answer a question for the chief, to be honest with you, but I do know, speaking with the chief, that no member has ever, in the history that we can find in all the records, going back to where America's hometown, where we're here first, was anybody ever found to be disciplined for being under the effects of drug or alcohol while on duty.
Okay, thank you. Any other questions? Mr. Doyle, you have a question, followed by Mr. Serkey.
Yeah, I'd just like to know how the FinCom voted on this and
Mr.
why.
Hanlon, if you'd be kind enough to share the FinCom's vote.
Sure. The Advisory and Finance Committee advises town meeting not to approve Article 1. We voted 5 in favor, 8 opposed, meaning opposed to the article, and no abstentions. I think it's fair to say that our biggest concern was the impact on the town's budget. One of the things, if you happen to have read the JLMC award, they talk about the town's ability to pay, and they cite our strong bond rating, our unused tax levy capacity, our free cash reserves, and other things like that. And I think Finance Committee is very concerned about the impact of this award on our town budget. That's the number one concern.
Okay, thank you very much. Mr. Serkey, did that answer your question? Okay. Ms. Bukes?
Yes. I'm not sure I should ask this question, but I'm going to ask it. How can you rectify the police department versus the fire department in their pay scale? How can you, in fairness, rectify that? Ms. Origi?
Ask the question, how can we rectify
How
something?
can you justify, thank you for reminding me, the difference? Because I see both departments as putting their life on the line.
Sure, definitely they both fall under that public safety. The positions are very different, and I would encourage you to take a look at the contracts, which are online. Every union bargains for things that they want, things they're willing to give up. So there are many people that have said to me, why doesn't longevity apply throughout all the 9 different unions? Well, some collective bargaining groups elected to give up longevity in exchange for something, and I'll give you an example. Mr. Brown referred to minimum manning in one of his slides. Well, years ago, I believe it was 3 town managers ago, during those negotiations, minimum manning was taken out of the contract in exchange for something, and that was a $6,000 increase on a base salary. So I think everybody is willing to do things a little differently. Fire shifts and police shifts are very, very different. So I know one of the things when we're in negotiations with the patrolmen and the superiors, they'll bring up different things in the firefighter contract that they may want. And the firefighters will do that as well, because there are a lot of similarities in the positions, but there are also real differences in what they want and what they want to negotiate. Otherwise, it would be wonderful if we could just combine them and negotiate together, but you can't do that. These are different unions. The only thing I want to mention is we're here before you tonight to present this article looking for town meeting's support for it. I don't want to leave anybody here with the impression that Plymouth, whether I'm your town manager or part of the negotiating team or somebody else's, is that we can't settle contracts with the fire department. 2006 to 2009, we settled a wonderful contract, but we were also offering 3, 3, and 3, 3% COLAs for each year. I mean, that makes a difference. So I think that we want to think about that. The employees in this town, not just the fire department, but we're coming off around in negotiations that were 0%, 0%, 2%, and some health insurance changes. So we understood it was going to be a tough round of negotiations with all our groups. The teachers, OPEIU and SEIU, were willing to settle for 4%. Because I think they wanted to. You know, it's hard to speak for them, but I got the sense, at least with OP and SEIU, that they wanted contract negotiations over. So I think in this case, we understood that we reached impasse and that we needed to look to the JLMC process to help us.
Thank you. Mr. Doyle.
Just to follow up, Mike, on your comment that the number one reason was money, and we're going to be voting on a lot of things we don't have money for. What's number 2 and 3 as to why you voted against?
Okay, thanks for asking. A couple of other issues had to do with the 24-hour notice of taking a vacation day. That was part of this award. We asked, well, if it's what was it prior to this award? And the answer was 2 hours. So as part of this award, now they have to give 24 hours notice to take a vacation day. My understanding is that that leads to the use of more overtime. 24-hour shift, the circuit breaker for the 24-hour shift. You know, we had an agreement on 7 days of average sick leave. Now, I guess reading the award, they got into there was a difference of opinion about how to calculate the average sick days, if you can believe that. So the solution was to raise it to 8. That seems a little. And once again, the award said that I think it was in 2012 they used 6.93 sick days, so that didn't trip the circuit breaker. In 2013, it was 8.5 days. That's what tripped the circuit breaker. So I guess the solution to the problem is to raise the threshold so that the circuit breaker doesn't trip. And then the issue of drug and alcohol testing came up. Public Works Department has random drug and alcohol testing, and one could argue between police and fire, there's lots of heavy equipment that's being operated. There are dangerous situations, and you know, it's a way to protect not only the employees but the public as well.
Thank you. Please join us at the microphone. Mr. Brown, if you could do that quickly because we're about 15, 20 minutes over. Thank you, sir.
I already covered the drug and alcohol testing, I think, and that kind of sums it up. But as far as FinCom was concerned, what I could tell from watching the meeting, they weren't too happy with the fact that if this award goes through, that we would be able to only have to call in 24 hours in advance to take vacation. The fact is, if this award is not passed at town meeting, our call time will only be 2 hours, which is what it is right now. We wanted it to stay the same. The town wanted it to be a week. The arbitrator didn't necessarily come to the middle, but said that 24 hours would be reasonable enough time for the shift to be filled. And that's what they said. 2 hours, they decided, is a little tight sometimes, so they bumped it out to 24 hours, and that was somewhat the concession that they made. And the chief had no disagreement with that. He believes he can get his shifts filled in that amount of time without having to worry about there being any vacancies. What was the other issue that the FinCom had? I'm sorry.
I think it was drug and alcohol, the circuit breaker.
Oh, yeah, the circuit breaker has been a hot button issue all along. The language that was written in the previous award had a lot of gray areas. Obviously, the town's going to interpret it this way, we're going to interpret it that way. And it was fought about in court, and lawyers had their opinions, and this lawyer had their opinion. But when it comes down to it, when we sold that first contract and we got our 24 hours implemented, we told the town that we were going to have reduced sick time. And I have a chart right here that shows in 2011, prior to going to the 24-hour shifts, our average sick leave per firefighter was 11.8. The first year of the 24 hours implementation, we dropped down to 6.93. The next year we were up to about 8. And like I said, it was called into question whether those numbers were accurate. Either way, we significantly dropped down according to this. So the 24 hours shifts are saving the town money. There's less sick use being used by the membership. If we do not pass this contract, there's a good chance that the town is not going to allow us to keep our 24-hour shifts anymore, and we'll be going back to the old schedule, to which there's a lot more opportunity for sick calls because you're here a lot more often. So.
Okay, thank you, Mr. Brown. Any other questions? Ms. Keene.
I would just like to know the members of your negotiating committee.
Who they are?
Yeah.
Okay. For the firefighters, me being the president, I'm on all of the committees by proxy. The chairman is Chip Hawthorne. Paul Alden is also on there. John Milne, M-I-L-N-E, is on there. Help me out. Jean Lane is on there. And I believe that's it. Oh, Jeff DeLapp is on there also.
And what was Paul's last name?
Alden, A-L-D-E-N. You're welcome.
Any other questions? I have a couple myself.
Okay.
Mr. Brown, you're all set, but thank you.
Very good, thank you.
Ms. Origi, I'd like to know exactly how many occasions the chief has requested drug testing in the history. None.
No. Please, I wasn't saying none. I really need,
I would
need
like
Chief
to know,
Bradley here, and
so
we'll find
you can
that
consult
out.
with him. That would be fine. And then secondarily, I would like to know if it's possible to get a comparison of the surrounding communities, and not just Sandwich or Duxbury or Kingston, but we oftentimes take a look at Brookline. We look at a number of communities and what they pay their employees. Like we have a comparison on with the cost per student for our schools. It compares
Well, it's
with other
different because, of
communities.
course, you have to add in all the different benefits. So if you compare town managers or firefighters or patrolmen, you're going to look at my base salary. You're going to see if I get any educational incentive. Another town manager might not. You're going to see if I get a separate life insurance policy, nursing home policy, what the value is to that. Does somebody get a car? So we can give you what we've put together, but when you look at overall compensation, for some people, they just want to look at baseline salaries and compare those. For others, they want to know the value of our health insurance, the value of our pension. So I can try and get you a basic chart. Often we have disagreements internally about what really is a true comparison. So I'll work with the union to provide you all with something that we both think makes sense.
And I don't want to be selective. I'd like to see a general number of municipalities, and I know I've seen comparisons before that include Brookline and Cambridge, and so Framingham. So I'd really like to see a general listing of comparisons from a salary perspective. If we could do that.
Yes.
Okay. Thank you. Anything else before we move on? Thank you very much, Ms. Origi. Selectman Provenzano, Mr. Brown, thank you. Article 2, supplemental for department expenses. Ms. Barrett, if you'd be kind enough to join us.